Today's episode tackles a paradox we don't talk about enough. We have more heart monitoring devices than ever before. Patches, wearables, watches. Data is exploding, but expertise is becoming scarce.
It's appalling that in nearly half of U.S. counties do not have a practicing cardiologist. We convert all nurses and paramedics into cardiac technicians. We won't be able to perform analysis on all the good data coming from the devices available in America.
And in many cases, critical signals are hiding in plain sight.
50% of cases of aortic stenosis are found post-mortem.
The ECG has been around for more than a century, but for most of that time, we've treated it as a simple rhythm strip.
There are more than 100 million ECGs done in the US market by itself and 300 million worldwide. We should take advantage of that data that is already available out there. Access save lives only if we can provide information in time.
Welcome back to Rounds, the podcast where we sit down with the innovators, clinicians, and builders shaping the future of healthcare. Joining me is Juan Jimenez, CEO of AccurKardia, a company rethinking what the ECG can tell us, not just about the heart, but about kidney disease, metabolic risk, and symptomatic health. AccurKardia recently announced its second 510(k) clearance with the launch of AccuECG 2.0, along with FDA breakthrough designation for novel ECG biomarkers, and acceptance into the FDA's TAP program. This isn't AI hype. This is regulatory-grade science aimed at enterprise scale. Today, we'll talk about cardiology deserts, why the ECG may be the most underutilized diagnostic tool in medicine, and how software, not hardware, may be the key to closing the gap between data and care. Juan, welcome to Rounds.
Thank you, Joseph, for having me. I'm looking forward to deep dive together.
Juan, you often talk about the cardiology desert, the fact that nearly 50% of U.S. counties lack a cardiologist. We have more heart monitors than ever before, but fewer doctors to read them. How is AccurKardia solving that disconnect?
Thank you, Joseph. It's appalling that in nearly half of U.S. counties do not have a practicing cardiologist, and there are more than 14% of more counties with just one practicing cardiologist, and the amount of cardiologists being retiring, it's not going to solve this problem. Doesn't matter if we convert all nurses and paramedics into cardiac technicians, we won't be able to perform analysis on all the good data coming from the devices available in America. So we believe software and the current compute capacity is the only way to be able to perform world-class analysis on those ECGs and empower primary care with world-class cardiology analysis. And that's what we're doing in AccurKardia. We're building a device-agnostic platform that ingests currently from clinical-grade devices, but hopefully in the future we can ingest from consumer-grade devices, perform top medical analysis, and deliver to primary care and cardiologists automated analysis so they can manage better patients and improve outcomes.
Well, certainly a scalable way to address the population that's out there where we ingest all this data, as you're saying. There has to be a way to manage that, and single cardiologists alone can't do that. They need some support. So the ECG, as we know, the ECG has been around for over a century now, quite a long time. And for most of that time, we've only looked at rhythms, right? We look at rhythm, we figure out, is there an arrhythmia here, yes or no? Why do you believe the ECG is actually the most underutilized data source in healthcare today, and what are we missing?
I think before I deep dive in that, I like to present a few facts that allowed for this to happen. One, devices are everywhere, not only clinical, but also consumer grade. We have wearables, now biofabrics being marketed in currently. In addition to that, compute capacity has increased and the cost of that compute has decreased. Secondly, there are virtual clinics and we call last mile clinical care delivery being available. Doesn't matter how much analysis we can provide. how early we can detect a patient. If there's no way to treat or manage patient at scale, we wouldn't be able to do justice. So I believe that availability of data plus the compute capacity as well as the unit economics plus the availability to deliver care at the last mile is what enable us to use ECG in a broader, bigger, more direct way than ever before. We have exploited we have used blood or DNA as other strong biomarkers, but ECG currently is being used for reading management, you pointed out, and a few other use cases in cardiology. I think there are a lot of researchers that have published the utility of DCG beyond reading management, and we are just scratching the surface. AccurKardia, along with many other great companies, are enabling us to use ECG beyond that. For example, we're working on using ECG for electrolyte dysfunctions such as hyperkalemia or structural heart disease, things that we haven't seen before. And because of all the factors I mentioned, I believe we can start using that in a big scale, and we're just at the beginning.
Yeah, you're certainly just at the beginning. And what's exciting, I see from my end, being in the industry about 25 years, is taking in a signal that we've let's not say take it for granted, but taking for granted most of what we could pull from that signal, the hidden treasures that we could figure out what disease a patient has based on an ECG. So AccurKardia just announced your second 510K clearance. And this was the launch of the AccuECG 2.0. The press release, as I reviewed it, emphasized enterprise scale, something you just touched on. What does that actually mean for the device maker or IDTF that is drowning in data right now?
So enterprise scale, what it means is that it is ready to serve low volume or high volume, high throughput practices, IDTF or device makers, able to use reliably. So we can able to ingest ECG data and produce results fast. Second, consistency in the results. And finally, unit economics that enable IDTF and cardiac monitoring companies to serve better the population they are serving. By given the reductions in CMS reimbursement rates over the last few years, we need to provide a solution for cardiac technicians to do their job faster, better, more consistent, so they are able to manage the increasing volume as well as providing better service to the patients they are serving. And AccurECG 2.0 enable our partners to provide results faster, making the cardiac technician job and nurses doing this ECG analysis better and more convenient, so we can serve more patients as well as keeping most of this analysis onshore. That's another factor that we are addressing, is that as the geopolitical changes happening currently in the world, we believe that for cybersecurity and privacy purposes, we need to keep more of this data onshore. And provided that, I think we are enabling with our software to provide become a partner with the cardiac monitoring companies, device makers, and IDTF to make this a viable option.
The application of this software we're just speaking about, I think, two use cases, which is IDTF and physician offices. But I think this goes well beyond that. But it further goes to show how AccurKardia is positioned incredibly strong for where where technology and the FDA and the healthcare community is heading. There's a term that's often used. It's called the data deluge. Every piece of data is now spitting out more and more and more data. And this is a common theme here. It's about how do we manage it? And I think coming back to AccurKardia and how well positioned you are, it's about managing that data and doing more with the data, but also trimming down that time of actually managing patient by patient how much data is being sent over from them. So how I'm also looking at AccurKardia is that unlike other ECG vendors that typically bundle the device in a closed platform, you don't make a patchwork device. You describe AccurKardia as a device agnostic platform. Why did you choose the software engine for everyone's hardware rather than building it yourself?
So I use the Intel Inside or the Microsoft analogy. I believe there are a lot of great devices out there already available in the US market that serve different needs as well as different geographies or different patient needs or clinician needs. Therefore, I think it's in order to have a bigger impact and a faster impact in the US healthcare system, we wanted to build a solution that was able to be plug and play with infrastructure already there. We do not require our partners, IDTF, DeviceMeric, to invest in new equipment or invest in new platform. We just can plug and play exactly in the workflows that clinicians, cardiac technicians, and IDTF already have, and we can ingest our solution in the current workflows and allow them to do what they know best, faster, more consistent, and more economically viable. And that's what we're solution. It may take longer, and it has taken us longer than if we have taken just the traditional, let's say, fully integrated model. But I believe that the foundational work that we have made is already up ready. So we can now enable our partners to grow together with us. We're already serving several hundred patients last month, and we are growing exponentially. And it just taken a few years to get the infrastructure in order, but now we are ready, and that's why we announced our new FDA clearance that enable us to be able to serve the different use cases that we want to go after without requiring investment in new equipment, new hardware, because I think there are already great options available in the market serving different customers and different needs. And I think we are ready to partner with them in order to serve better the patients and clinicians that we're serving.
Well, Juan, that's certainly a powerful strategy when you think about having an agnostic solution. Your market cap, or how many customers you could serve or patients you can access, completely changes the game here. You could potentially be put into every cardiac monitor, every watch, anything that has an ECG output can have an AccurKardia engine behind it. So incredibly strong. So you're expanding beyond just the regular rhythm interpretation of the regular ECG, which is something we continually are talking about here. Can you explain how that shift means and why an ECG should be detecting more than just cardiac issues?
I like to clarify that we don't consider this to be a shift. We consider it to be a natural progression of our journey. We want first to be able to have a solution that serves the status quo and the traditional use of ECG, which we believe requires a new infrastructure, a software infrastructure layer to improve the current workflow. And that's what we have in the market and expanding. But and as I pointed earlier, there are more than 100 million ECGs done in the US market by itself and 300 million worldwide. And we should take advantage of that info data that is already available out there. ECGs are ubiquitous. ECGs are available everywhere. Any physician can prescribe one. The cost per unit is low. So why investing in new tests, new solutions, new infrastructure? Why not using the information we already have? We're sitting in a powerful amount of information just ready to be tapped. And that's what AccurKardia is doing. There are dozens of hundreds of researchers and great companies publishing how the value of ECG just beyond traditional rhythm. There have been publications earlier this year. There was a publication about using ECG for glucose monitor. There have been research done by Mass General and Harvard researchers that ECG can we can phenotype up to 600 different conditions. So AccurKardia, we're just scratching the surface and using a few use cases, and we decided to start using where we see fit and adding to the infrastructure we already have, and that's what we are doing. It's a natural progression of our work, a natural progression of the ECG as a biomarker term that we did not create. We are embracing it, and currently we are working on expanding on research that we have done But hopefully in the future, we can bring other research and other IP from other researchers and companies into our fold and be able to make this infrastructure available for the healthcare market.
So you have two exciting technologies you just released. One of them is called AccurKardia, and one of them is AccurAVS. So the AccurKardia is identifying hyperkalemia, and the AccurAVS is for aortic stenosis. So let's speak about each one in its own respective vertical. So AccurKardia, you're using a lead one ECG, similar to like an Apple Watch, right? That same type of one lead ECG to screen for potassium levels in the blood. For kidney disease patients, what is the impact of bringing the lab test into the living room?
Sure. So our work on AccurKardia is that we are, as you mentioned, we're taking lead one ECG data from clinical devices, and currently we are in a pilot using consumer wearables such as a watch. So we're using ECG to detect moderate to severe episodes of hyperkalemia, which are high potassium levels, and it is a huge impact in chronic kidney disease, end-stage renal disease, and heart failure patients. And for example, in the case of heart failure patients, they may be in certain prescription drugs that may exacerbate the way the person metabolizes potassium. And what happens is, at the first instance of a hyperkalemic episode, the prescribing physician or managing physician of those patients may stop therapy for certain drugs that improve the condition of those patients. So, and if hyperkalemia is not properly managed, it can cause severe arrhythmia that can in turn cause sudden cardiac arrest. So we have built this model that detects moderate to severe hyperkalemia in these three segments of population: CKD, ESRD, and heart failure patients. And we have been able, with high accuracy, been able to detect those episodes. As I mentioned, we're currently right now in a pilot with 150 patients doing this analysis prospectively. We have presented already data on more than 150,000 patients retrospectively, and the results are promising, and we are right now translating that into the future. What we believe that is that we're going to be able to manage better CKD, ESRD, and heart failure patients, being able to manage better their therapies, and in cases of hyperkalemic episode, we can address them faster, prevent a hyperkalemic admission, because usually each hyperkalemia admission costs around $30,000. In addition to that, in ESRD, for example, 40% of mortality of ESRD patients is due to hyperkalemic episode. We can help save lives. We can help reduce costs and better manage patients with their therapies that to improve the kidney function and improve their heart failure condition. We're going to be able to improve outcomes, and that's what we are building. AccurKardia currently is in the FDA TAP program. It's not yet FDA clear. It's available only for research purposes. And we believe in the upcoming quarters, we're going to be able to have our first submission to FDA for our AccurKardia product. And hopefully soon thereafter, we're able to market that solution. Currently, we're looking for research partners that may have interest in using our technology for their own studies. So we're able to continue testing and enhancing the capabilities of AccurKardia.
Certainly a very strong technology, but before we jump off it, we also have to talk about your other technology you're releasing, which is the AccurAVS for aortic stenosis, which is typically called a silent killer, because when it's missed, it's usually too late, right? So how does your AccurAVS technology find these patients using existing ECG recordings without requiring any new hardware?
Yeah. So first, 50% of cases of aortic stenosis are found post-mortem. So it's in a post-mortem finding patients that had aortic stenosis, because sometimes you may have a patient, no symptoms, maybe have other symptoms that may be confused with someone else, maybe symptoms of aging, fatigue, etc., and they may found too late. We are using ECG data already there in the electronic medical records or the ECG repository. So for AccurAVS, we are using data from 12 lead ECGs that are as I mentioned, there are more than 100 million performed in America each year. And we're using data from those ECGs to be able to screen for patients that have potentially moderate to severe aortic stenosis. We can run retrospectively those ECGs and be able to flag them for continuing or confirmatory echocardiography. Not if a patient is already in a cardiology practice, most likely they're going to be found that have aortic stenosis. But not everyone have access to a cardiologist. As we mentioned in the beginning of the show, 50% of counties do not have a practicing cardiologist. There are many places that they may have to travel 80, 100, 120 miles to find a cardiology practice. So if we want to empower primary care, we need to provide these tools at the general physician clinic, at the urgent care clinic, at the pharmacy. So, and using the ECGs already available in the market. So, so that's what we have built. This our AKABS is in the FDA Breakthrough Device Designation Program. We have published in our website. We have several publications of our results. We are very excited about the promising results that we have been able to identify. And also, we have been able to use our model not only to detect moderate to severe aortic stenosis, patients that may have moderate to severe aortic stenosis to refer them for echo, but also using that for prognostic capability. Let's say you may have a subclinical aortic stenosis, or you may have mild to moderate aortic stenosis. Currently, the treatment for aortic stenosis typically is a valve replacement using a TAVR procedure. But currently, it is only indicated for symptomatic patients. But if you want to have a solution that is cost-effective to manage those patients, the ECG is cost. The cost is very small, so we can manage patients in between echo exams. We can manage them with ECGs, and also ECGs can help us find patients that maybe they had an echo, but they were not followed through. They were not referred to the heart team, so the procedure may not be completed. So ECG could be another tool to flag those patients and refer them to the proper treatment. And that's what we are doing. We have published on detection. We have published on how we can use it for prognostic capabilities, how we can predict the need of pacemaker using our model, or even in the future, recommend a better valve for a particular patient using an AI model. And those are the things that we're right now researching and trying to get clinical data. And we have presented, but we'll present more in the coming years, because we believe research and validation is as important as regulatory clearances. And those regulatory clearance and validation are essential for marketing. So that's what we are doing, and combining the efforts of good, strong research, strong regulatory efforts, so we can have better go-to-market capabilities.
The viewers should think about this as a couple ways. It should be viewed as one, proactive flagging of potential issues, right? And when you proactively flag those potential issues, it's about early intervention. How early in that disease progress can you get a patient to want to identify that particular disease and then treat it? And healthcare loves that, right? Because when you think about early intervention, we're thinking about a cost savings to healthcare. You're thinking about saving yourself from a potential progression of a disease well before. So it actually starts to move more into that prediction where AI is heading, right? AI is great at gathering data. And now it's also the next evolution is, right, how can we predict what's going to potentially happen in the near future? And this is where AccurKardia's strength is going to be, is prediction, early intervention, and the application of that can be used in a host of different hardware products. Which also brings us to the most recent second FDA clearance that you received here. So you're looking at the AccurKardia, the AccurAVS. You have a host of different clearances, FDA approvals you're looking at. And the TAP program, just to jump back to that briefly, the primary goal of this was to expedite patient access, right? So it's about what's the FDA doing to allow the healthcare, let's call it medtech, to get this technology and get patients to access it early on to intervene with issues. And that's what the TAP program's objective is. I think a few weeks ago we had Dr. Marty McKay, who's the head of FDA, come out with groundbreaking programs such as the Tempo and the Access. We won't dive into that today, but it's more reasons of how the FDA is wrapping their hands around medtech, bringing it closer, because they know that AI and these particular technology, specifically AccurKardia, is going to help patients. And why delay that? Why delay the approvals of those for years and years, as historically the FDA has been? But it further goes to validate everything that you're saying, Juan. So let's turn to some skepticism out there about AI, and there's a term used as AI hallucination in medicine. How do you validate your models, specifically regarding the ground truth data, to ensure that a cardiologist can trust what is being put out there? So the output is something that the healthcare community can trust.
So all the technology that we have built is not a black box model, black box output. On our FDA clear product, we provide all the building blocks to the reviewer of that output for a particular suggestion, indication, or recommendation. It is not a black box model that throws, you may have condition X, condition Y. We provide all the, in particular ECG analysis, all the ECG parameters. We provide all the ECG building blocks, heart rate, ectopic counts, show you how where it looks, onset, offset of episodes, as well as for aortic stenosis or hypertension. We have different indication, different parameters that are influenced for a particular recommendation. So therefore, we by providing transparency and openness of a particular output is what we believe provides more assurances and provide more trust in our reviewers. Secondly, it's not only providing a solution that provides an output, only enabling a reporting and analysis capability to bring the clinician openness to go in, provide full disclosure of the information, as well as going in and reviewing, editing, and disagreeing with a particular recommendation that some of our products may provide. That is one part. Secondly, is that we follow the rules and we go by the U.S. regulatory framework that we have. You pointed out, we believe FDA is doing a great job, and with every new initiative there are right now bringing to market or bringing to the public, it's enabling innovators such as AccurKardia to bring products faster and to bring products more regulated by the proper parties when they have to be regulated. And then finally is validation and publication. We have products that are being validated, and we continue to do that effort. And there is never enough validation you can do to be able to prove this. And finally, continuous improvement, because some of these technologies are meant to be evolving and meant to be improved, and that's why we are committed to have the resources to bring the technology to market. If you have a product that is stale for more than 12 months, 14 months, you may have an outdated product. So that's why we have Accuracy 2.0, and we're already working the next generation version of our product. So having that continuous improvement and continued development is what makes a product shelf life longer, as well as for building more trust to the clinicians that are using our technology.
Yeah, Juan, we just spoke about Dr. Marty McKay coming out with the FDA with all of these different programs, and why that question is so critical, especially now about the skepticism of the data coming out, is because the FDA has taken a very pro wearables and AI position. Let me further clarify that. So a lot of in the past, wearables would have to go through some rigorous FDA filings to get approval to come to commercialize the market. Well, what Dr. Marty McKay and the FDA have decided is that now they're going to have two verticals. One of them are over-the-counter products that will, pull one of many different biometric data points, but it's unregulated. Claims cannot be made that you could do anything with that, which is actually a very good thing for the medical device community, because what it does is it brings more attention to patients, more attention to these various biometrics that can throw up red flags. But what happens after that? As you wear one of these unregulated, or let's call it over-the-counter products, that flag is going to pop up and letting you know you have AFib or you have some other biometric disorder. But then it's going to filter and feed the more clinical grade technology. That's where the AccurKardia is going to sit in many of these hardwares. And that's where your diagnosis is going to come up from. So there's going to be a healthy amount of skepticism for the OTC products. But then for the medical grade products, because of all of the skepticism out there now, you're going to have to show some transparency. And Juan, exactly what you just shared with us is what's going to be needed with not only AccurKardia, but the majority of technologies out there that are going to spit out biometric data. So incredibly powerful where healthcare is heading now. So I think those are important items to understand why that question of skepticism is out there. So let's turn a little to the vision, right? We'll shift a bit. And we're going to talk about multiple disease states that a patient may have. And you may have heart disease, kidney disease, metabolic problems. Right at the current state of where healthcare is you typically need about 2, 3, 4 different physicians who are going to treat each one of those respective diseases in its respective silo. So how AccurKardia's technology is going to bridge that is that it's going to look at the cardiorenal metabolic syndrome patient. So share with us how you're wrapping your hand around the patients and saying, rather than multiple physicians, which you still may need to get to, how is AccurKardia going to address the cardiorenal metabolic syndrome patient?
So by enabling primary care and by using the ECGs already available in the system, we will be able to provide information to primary care to better direct patients to cardiology, to metabolic, endocrinology, as well as nephrology when needed, and manage those earlier than ever before, because we're going to be using information and resources already out there. We are not adding new studies. We are not adding new devices. We are just using information already available out there to be able to identify risk factors with particular information that going to enable primary care to direct cardiology earlier or direct resources when they need to. Because right now, there are, for example, let's say the case of atrial fibrillation. More and more primary care is prescribing cardiac monitoring solutions to be able to detect atrial fibrillation early on before cardiology. There are places around the nation, the waiting time to see a cardiologist may be 20 days, 30 days, 45 days, 60 days. There is not enough capacity to be able to manage the increased volume of patients given the comorbidities and the profile of the current aging population that we have in the nation. So therefore, by enabling primary care and identifying those risk factors and those conditions earlier, structural heart disease, rhythm disorders, metabolic disorders, and kidney disorder, we're going to be able to manage them earlier when therapy is available. We can preserve kidney function longer. We can manage the kidney condition better. We can manage heart failure patient earlier and treat atrial fibrillation earlier, so we can reduce the progression of the disease as well as the cost associated to the disease. So I believe that companies like AccurKardia, what we are building is we're going to be able to improve outcome by earlier detection, earlier management, and long-term increasing the clinical the patient outcomes by improving life, quality of life, as well as overall cost associated with managing those patients, and the initiative being right now being put in out there by enabling different OTC and wearable devices, empowering the patient, empowering the consumer to be able to be more proactive with all those initiatives, and together with initiatives like companies like ours. We believe we're going to be able to contribute in improving the healthcare outcomes of the nation, as well as managing costs, because we cannot allow this cost to continue to increase the way it has been into the future, because in the end it's going to be unsustainable.
So, I mean, the application of this, as we're talking more and more, and as I've done more research into this, I mean, the application of this continues to grow and grow. And I'm sure as you begin to develop, you might even come out with more of these ways of looking at the ECG to identify even more than what you're looking at now. So as you think about commercialization, you look forward to, okay, how do we get access to patients here? Who are the ideal partners that you're looking at now? So you're now live with AccurECG 2.0, and you're running pilots for various biomarkers. Who is the ideal partner for AccurKardia right now? Is it the hospital system? Is it the device maker? Or is it the pharma company?
Well, I like to say all the above, right? All could be the right partners, but I believe that for AccurECG and the current pathway, cardiac monitoring companies as the full integrated IDTFs and device makers are strong partners for that particular use case. We can use the capabilities of AccurECG for retrospective and prospective detection of different rhythms with data already out there. So hospitals, we can enable hospital systems to be able to use ECGs they may already have stored or they may already generate to flag cases missed. For example, in some work that we have done, we have seen in primary care, atrial fibrillation being missed more than 20%. So I haven't really gotten into the novel biomarkers, just on traditional atrial fibrillation use case. Sometimes it is missed in primary care. If we can enable and empower primary care to detect those patients, they can be referred for Holter or a cardiac patch or cardiac monitor, so we can manage them better and refer them for therapy or ablation treatment. So, and then it can be used as a companion tool to be able to better manage, for example, chronic kidney disease and end-stage renal disease patients, the hyperkalemia work that we're doing, and with tower manufacturers to be able to identify patients for aortic stenosis treatment earlier than before. So it's a combination of factors, but we believe we have to have the right solution for the right partner, and that's what we're building.
Well, most of what I'm hearing sounds like we're talking about the future, right? But this is here now. But let's look into the future. So if we looked 5 years into the future, where do you think ECG fits into the standard of care at the primary care level?
No, at primary care, we need to, let's say, first address the low-hanging fruit. I truly do not want to see undiagnosed cases of atrial fibrillation 5 years from now. I really want to reduce that as that's part of my goal, is to be able to provide our solution out there in the market to be able to identify those patients earlier than ever before. And we have seen other companies doing those initiatives, and they're being very successful. We have to empower primary care and using technologies that the one we are building for prospective and retrospective detection of AFib earlier than ever, and be prescribed a Holter monitor or a cardiac patch for confirmatory work, and then working through that workflow to be able to reduce preventable strokes. That is being proven, so we need to follow that. And then on top of that, being able to use all the ECGs that we already have, not only on the clinical side, also on the consumer side, personal side, being able to use those ECGs to identify earlier cases of aortic stenosis, better manage hyperkalemia on patients with chronic kidney disease and end-stage renal disease, and detecting heart failure, low ejection fraction, and so on. So I think we want to see ECG to be in the same footing as other biomarkers, such as DNA, blood, etc., and be able to use that information because the plain eye cannot see this. We may have great cardiologists, but cardiologist time is limited. So we need to empower all healthcare system to use the information we already have, because for most of the conditions we already have good treatment and we have options for them. So let's enable them with the information that we already have without adding new equipment, new capital expenditures to the different healthcare systems for the information that we can provide.
Powerful. So, Juan, if the audience remembers one thing about AccurKardia and where ECG is heading, what should it be?
So access save lives only if we can provide the information in time. It doesn't matter how good we can build, how great stuff that we can do. If we cannot provide that information early enough and on time, we are not going to be able to make an impact. And that's why that's why I'm doing this. I'm doing AccurKardia, because we want to build technology that make an impact, and we have to deliver that information fast and in a convenient way without adding too much burden to the system. And that's what we are building in AccurKardia, right? We are using the ECG with the infrastructure we already have and provide information fast in a consistent manner so clinicians can act upon that information and better manage patients. And that's what we are doing, improving outcomes one ECG at a time.
Juan Jimenez, CEO of AccurKardia, thank you for being on this episode of Rounds. I think it was a powerful way to contribute to the commercialization of your company, your product, and all the future things, great future things that technology you have coming to market to help the population, but also to help the medical community in managing a lot of this data that's being submitted to them. So thank you for your time.
Thank you, Joseph, and thank you for the opportunity.